Welcome back here on the Roundtable for this Sunday afternoon. Once again, appreciate you spending some time with us. You know, it's an old adage, whether it's you or somebody you know down the street, chances are somebody has been affected by cancer, and it's a troubling statistic. Kelly Morse, Jill Johnson, and Bonnie Graytop joining me this afternoon talking about some of the things that are being done locally as far as survivors are concerned, the Survivor Center here locally, and also the genetic testing that can be done here locally as well. Something I wanted to show you there at home. Take a look at these statistics that the CDC put out. These are the most available numbers that they have, 2009 figures coming to us when it comes to Ohio and Michigan and the cancer incidence rates per 100,000 people. And when you look at the types of cancer, some of these figures may surprise you as far as where Ohio and Michigan fall in the rankings. Incidents of breast cancer are actually, believe it or not, in the low range for our part of the country. Cervical, low to mid. One of the highest is uterine, ovarian, lung, and colon cancer in the mid to high range. When you guys look at these, I guess where everything falls in the rankings, I mean, is it something that kind of falls in line with what you deal with every day? You see lung cancer being high in this part of the country. Makes sense?
I think so. I was a little surprised to see that breast is lower, but from a genetics perspective, BRCA1, BRCA2 are very in the media. They're very much on the minds of families that have a lot of breast or ovarian.
Yeah.
So for me, I do see a lot of breast. However, it is encouraging to know that within our area, it's actually a lower incidence than some other areas of the country.
Well, I think that's interesting what you just brought up, the fact that because breast cancer tends to get so much play as far as the media and the discussions as far as getting tested, mammograms, so on and so forth. You look at that, the rest of that list, and do we do a poor job? I mean, should there be more talk, more articles, more stories regarding the other cancers that are out there, or do you think the others are getting good attention?
I think they all are getting good attention. It's just the matter of the research that's being done. Again, you can't predict what the findings in the research are going to be. So I think that I think there's attention to all of the cancers. I think obviously breast cancer, I think, gets a lot of attention. As we're going, I think more and more of the cancers are getting more attention. Even though I said yes, maybe they are getting it. I would like to see a little bit more, and I think that's coming. Mm-hmm. I think people are recognizing that as they make advances in some of the cancer treatments, that maybe now is a time to take a look at some of the ones we haven't looked as closely at. Mm-hmm. But I do believe that there's research being done in all cancer fields. But I think as we go along, you'll see more and more.
During the summer months, we always talk a lot about skin cancer and what's being done to try to combat that. Do you see an uptick or things that people should be mindful of as we head into another summer season?
Well, again, I think that, protecting yourself from the sun obviously is the number one thing that you ought to do.
You guys watch the news. You see these stories that come out
Right.
and say, nothing can replace vitamin D. So now there are stories coming out saying, get out in the sun. Get your kids as much sun as possible. Completely contrary to what we have been putting out there, what you as medical professionals probably have understood for the last couple of years. Does any of it make sense?
Well,
is there some truth in between both of those?
Sure, it is, because yes, there is the vitamin D from the sun, but what you want to do is protect yourself from the harmful rays so that you are able to take advantage of the good vitamin D
Sure.
that you get from the sun. So if you protect yourself, with sunscreen, at appropriate SPF, that sort of thing, you're still going to be able to take advantage of the, quote, vitamin D that you get from the sun.
But we still have this, I guess, this mantra that, man, you look good, you got a tan, you vacation, looks great, right. but yet that's telling people, well, he or she's been out in the sun. Naughty, naughty.
Right.
That
right.
kind of thing. So is it a mindset? Why don't you jump in?
I just think that it's moderation too, and using good sense.
Yeah.
And being in the sun later in the day. I'm not an expert on that, but for
because
myself.
Because melanoma cases, there's
right.
been a definite
Absolutely.
increase over the years.
Right. So you need to be smart about it, and you need to choose when you're going to be in the sun and not be. They say between 12 and 2, I think, is the worst time. So
Yeah.
after 2, plenty of sunscreen and moderation.
Over the years, we've seen an increase in the number of these Safe in the Shade walks that happen during the course of the year. Check local listings here. Check 13abc.com for the ones that are happening in our area. As we continue on the talk about genetics, and is there any predetermination as far as skin cancer is concerned?
Yes, there is. For melanoma especially, it is nowhere near as common or as well understood as maybe breast cancer or colon cancer. We know of one gene in particular. It's called P16, and in families there are increased risks for young ages of melanoma diagnoses as well as multiple melanomas within the same individual. In these families we also see increased incidence of pancreatic cancer. If one of these families were to walk into clinic and to see me, we would really stress more so even over the general population the importance of safe sun, high SPF, wearing protective clothing, shade, no tanning beds, and really understanding how to screen yourself for melanoma.
But that gene that you talked about, the one specific to melanoma, nobody walks around with a scarlet letter on them. How do you know right off the bat? Like, I've got 3 kids at home. I don't know if one of them is susceptible to it. Outside of getting them genetically tested, is that the only way to figure out?
It is the only way to know definitively. However, if you are seeing that in the family there's increased incidence of melanoma, increased incidence of other types of skin cancer, then apparently there's something going on. We might not even understand it completely from a genetic or a medical perspective yet, but there's something going on in this family. So being proactive, doing safe sun practices and things like that to decrease the risk of melanoma.
Talk a little bit about, you are a member of the Oncology Nurses Society, and as a group and coming together and trying to discuss, I guess, dealing with cancer in 2013. Where are things? Where is the read as far as Northwest Ohio and the care that people are getting here? They don't need to go elsewhere, do they?
I don't think so.
Yeah,
No, we have the Hickman Cancer Center at Flower Hospital. UTMC has a cancer center now, and the Mercy System, I believe, also has some cancer programs. So there is, I think, adequate coverage in terms of diagnosis and treatment. Kelly is the only certified genetic counselor in oncology in this area, so we have that advantage. But I would say that in this Northwest Ohio, Southeast Michigan area, there are plenty of facilities and resources available for cancer and supportive cancer care and survivor care.
And obviously the biggest thing, and I talked to our audience a little bit, we got a couple of minutes left, just about the education that you get a diagnosis, the education that goes into each family, each patient. Can you touch on that just a little bit?
Sure. I think that whenever a family can be involved as the patient learns of their diagnosis, that's important because that support for them from family and friends is most important. The explanation usually is pretty much what the patient wants to hear and is, I think, able to understand. They are given the diagnosis and treatment options from their oncologist. If they're having chemo or radiation, the nurses talk to them about what that means, what to expect, what the side effects might be, what we do for those side effects or to try and prevent those side effects or minimize them. Yeah. So they are given a complete informational package, I guess, regarding the point of diagnosis through treatment, and then even at the end, we have the survivor program. So that is also indicated that when they are at that point, that is also available to them. So I think they're actually very well informed. And again, there are people who want that information. There are other people who say, don't tell me all the gruesome details. Just let's just do what we need to do.
Once again, I want you to mention, get that plug in there, June, coming up later this month.
June 18th, 19th, and 20th at the Rec Center at UT.
And specifics again, it is the CHAMPS?
CHAMPS program for kids that have a loved one with cancer, ages 6 to 17. It's free.
And a great opportunity.
They can look at our website, promedica.org, CHAMPS, to find more information and my phone number.
And you kind of stole my thunder. I was going to send everybody to promedica.org already. Ladies, thank you so much for spending some time with us here on the Roundtable. Stay right there. We will wrap things up for this Sunday right after this.